Welcome to another episode of Sweet 915. I'm host Curtis Smith and my co-host.
It's me, Fedora. Hey, Curtis. I did this just for you, Curtis, just to put a smile on your face.
Hey, she's filled with the holiday spirit and she wants to just spread the Christmas cheer. So I will not mess with her today.
That's right. Don't mess with me. Don't judge me.
Santa's little helper has come all the way from the North Pole. Oh boy.
I'll take my glasses off. All right.
Okay. All right. Well, welcome back. Here. Welcome back, Fedora. Welcome back.
It's good to see you.
It's good to see you too. Even though we saw each other yesterday, spreading Christmas cheer, trying to get some the pop-up store. Some great things at the Y. Yeah, pop-up shop.
I really had a good time.
Yeah, I did too. Got to see some different faces in the place. So thank those that came out to support the event. We got to shake hands and say hello to some people.
Yeah.
So they were looking forward to seeing us this weekend. Yeah, they were looking forward to. I said they were looking forward to seeing us this weekend. I got a lot of texts and calls about what y'all going to talk about tomorrow. And I said, well, we're going to talk about something very interesting that needs to be talked about that nobody wants to talk about. But today we're going to talk about it. And we have a professional. That's right. And we have a professional that's going to come on today. So, but let me give them a little update right quick. Beginning in January, we will begin our new format that will be more interactive and include your inputs as viewers. We're very excited about the changes.
Yep.
It's going to be a good that way, if you want to talk about Fedora's glasses or her African attire, you just say, Fedora, you are wearing those glasses today. You're wearing those glasses today, girl. I love your hair, Fedora. That's right. I love your hair, Fedora. Okay.
Silly.
And so, so we're going to show you a little bit of COVID updates because, you don't want to talk about it, but the numbers are kind of rising. So we need to talk about it so you can be aware. Here are your numbers for COVID-19.
And I think this is on the 29th. This is as of the 29th.
29th?
Mm-hmm.
Okay.
The 5th. Okay. The 159, 330 is as of the 29th. 2,872 deaths. Yeah, so the cases are rising.
Yeah. So and today's guest going to talk about it too. So we're going to let him do his thing. Excuse me. But today's topic, sexual activity in the age of COVID. We're going to talk about COVID-19, sexual activity, and infectious disease. But before we get into that, we're going to let Fedora give us a little bio on our guest today.
Yes, we have the medical director of Sunset ID Care, Dr. Ogechika Alozie. He is a graduate of the University of Minnesota's Infectious Disease Fellowship Program. Prior to this, he received his medical degree from the University of Benin in Nigeria, and then completed an internship and residency at the Hennepin County Medical Center in Minneapolis, Minnesota. He is also board certified in clinical informatics by the American Board of Preventative Medicine, making him one of less than 100 such certified physicians in the state of Texas. Dr. Alozie believes that patient care is the most important part of medicine. Technology is not a replacement for patient care, but rather a way to enhance and catalyze the care our patients deserve. So we would like to welcome Dr. Ogechika Alozie to Suite 915.
Hello.
Welcome, sir. Welcome.
Appreciate
it. Hey, so you're going to give us some good information today.
I'm going to try my best. I mean, it may not be good information because some people might not like it, but I'm going to tell you what I think is real.
Well, that's why we brought you here, so they can hear about it. As some people, they don't want to hear the truth, but they need to be told the truth. So when you contact COVID or other infectious diseases, you can't say, well, Dr. Alozie didn't jail me. Yeah, I told you what could happen if you did this or that. The cause and effect thing that we talk about. But let's see.
Where do you want to start?
Let's see. So the first question that we have is, what is the status of COVID-19 here on the board of El Paso to include increase or decreases in the numbers, younger El Pasoans contracting the virus and the new variant?
Absolutely. So first of all, thanks for having me. Happy Sunday to everybody. I will say that the next time we do this, I got to switch up that picture. I'm 60 pounds lighter, and that picture literally makes me look like a balloon. And
no, it doesn't.
No, it don't.
No,
you look smaller. You look smaller than the last
see
time.
My neck now. You can see my neck now. You couldn't see my neck before. Yeah. I think that's one thing. That's one thing we got to talk about. But I think on a more serious note, though, I mean, the community, it's in an interesting position. And I think when people say, hey, where are we? The first thing I ask them is, are you vaccinated? Right? Because if you are vaccinated, I'm having a very different conversation with you. And people always say, well, some people say I blow it off. Some people say I overblow it. I'll tell you what I do. And I tell you what my family does, right? I've traveled to 3 foreign countries this year. I am vaccinated. I got COVID almost a year ago this time last year on December 18th. I got my Johnson & Johnson on April 1st. I spent 2.5 months in Curacao treating over 100 plus COVID patients. I've since come back. I've gone to London, and I just got back from Curacao again on vacation after getting my Moderna booster, right? And so for me, COVID is not an issue. Will I wear my mask when I'm at work? Absolutely. I see 40 to 60 patients a day, and I wear a mask with all of them. Do I wear a mask on social occasions? Absolutely not, because 99.99% of my friends are also vaccinated. And so whether it's a wedding, whether it's a meeting, whether it's going out to a host of different restaurants in the community, I feel completely and comfortably safe doing all of these because I'm fully vaccinated. Now, if you were to tell me, hey, I'm not vaccinated, right now is not a time to be doing whatever it is you want to be doing in El Paso, because the cases are almost 2 to 3 times what they were just a month and a half ago. We now have some of the highest rates that we've had this year in El Paso. And you showed some of those numbers where it's getting 300, 400, 500 cases a day. We haven't seen that many cases in a week since January and February of this year, when we were coming out of that worst curve that we've ever had. That was November, December of 2020. And so if you're unvaccinated, on average, a lot of those people show up in the hospital. And so when I talk to people, and I saw probably 20 COVID patients today, 18 of them were unvaccinated, and they all said, well, I wish I had known. And so it's not that people don't know. We're living in this era of misinformation where the 10% and the 15% are driving the narrative so much that the reasonable 80% are following that instead of following what they should follow. So again, I mean, I think I got 2 kids. I got a 15-year-old daughter and an 11-year-old son. I had to think about my daughter's age real quick because she acts like she's 25. But I got a 15-year-old daughter who's fully vaccinated. My 11-year-old son just got his vaccine 4 weeks ago, the first shot, and he'll get his second shot in January. So traveled across the world with them and feel very comfortable traveling across the world with them, because even unvaccinated, when I went to Europe with them, I understand that on average, kids do not get as sick with COVID, and they are better off than a 50, 60, 7-year-old who may be overweight, may be older, may have diabetes, may have multiple myeloma, a host of other things. So that was a long-winded answer to say it all depends on what your status is in terms of vaccination.
Okay.
If there is a significant increase, what do you believe is the cause, and what do you believe could and should be done to alleviate the problem?
Here's the thing. Anybody that tells you they know why, just ignore them, because they don't. You're going to get a lot of people that will make assumptions. They'll say it's because of masking, it's unmasking of kids. Here's what we know. The Delta variant, which is the predominant variant in the United States, is more transmissible than the COVID variant that we had in 2020. Remember, kids weren't in school in 2020 for the most part. And when they did come back in the early part of this year, a lot of kids didn't return. And then we had the summer months, right? So people were outside. We've put them back in school, irrespective of masks. It was expected as it gets colder, as the Delta variant moved from the south into El Paso. I will say this, one thing people always forget, El Paso, for whatever reason, doesn't tie in with the South or the West when it comes to a lot of these surges, right? We have our own little timing because we're Southern because we're in Texas, but we're not really part of the South. We're not Alabama and Arkansas and Florida, and we're not California and Oregon, right? So we have our own little niche where we get things a little bit differently. This could very well just be the natural evolution of the Delta variant as it swept through the South and has now gone up into the West, the Northwest, and the Midwest. They're now seeing the highest rates that they've seen in a year. I think the other thing, too, people will say, well, is the border. Again, I'm not really sure about that. We've had a border that was essentially closed for over a year and a half, and we had already had cases going up before the border. What we do know, though, is this. The Delta variant, more transmissible, more contagious than it was last year, and kids were not as protected as adults by the time they got back to school. 5 to 11-year-olds were not protected at all because they hadn't gotten the vaccine. And the uptake in the 12 to 18-year-olds hadn't been as brisk as we had seen it in the older population in this community. And so they were vulnerable. Hey, kids being kids are going to do what they do, right? They'll walk into school with the mask when their mom and dad are looking at them. And once they're howling at their friends, go, what's up, man? How you doing, baby? And all of a sudden the masks come out. They're at lunch. They're playing sports. So absolutely makes sense that it will spread in those kind of congregate communities that are schools. I think the good news here is that are there unfortunate cases of kids that have been admitted to an ICU that have died? Absolutely. But as an epidemiologist, if you look at those numbers, they are nowhere compared to what it is and what it was for adults. I think that's a blessing. However, I'll still tell parents, try to get your kids vaccinated when you can.
Oh, outstanding. So when someone who has been fully vaccinated dies from COVID-19, but also has underlying health conditions, is it a possibility that they may have succumbed from the underlying conditions that may have impacted their immune system rather than COVID-19 itself?
So the short answer would be yes, but I think it's a lot more complex than that. And I think I like this sort of forum that we have because we can dive into that a little bit more. As you know, our colleagues in the media, they're looking for sound bites, right? They want the quick sound bite. They want you to click on a button. They want you to be outraged and amazed by what the headline says. And it's not that simple. If you look at the 10 people that died this week, 9 of those were completely unvaccinated. The one person that died that was vaccinated, I think was 68, had multiple medical comorbidities or issues. And this is what people are not understanding. In December of 2021, you are no longer fully vaccinated if you got either just Johnson & Johnson or if you got 2 mRNA shots. To really be completely protected, you need to have gotten a booster. And so I personally have not seen, and I have not seen the health department talk about this directly, but the people that have died were unboosted, right? And so I think that is one thing that is important for us to get out to the community. If you got Johnson & Johnson at any point in time during this year, consider yourself partially vaccinated. You are no longer fully vaccinated in December of 2021. If you got an mRNA vaccine, either Pfizer or Moderna, more than 6 months ago, with the way that this is now spreading. If we were having a conversation in June, July, very different conversation. But right now, in December going into January, that we have our highest rates in the community, if you've gotten 2 shots and haven't gotten your booster, you're no longer fully vaccinated. And I think that has to be the message that we explain to people so that they don't think that 2 shots in February is the same thing as somebody that got 3 shots and got their most recent shot a week or 2 ago.
Okay. That's very important. Yeah, because I know some people were saying, oh, well, the way the second shot affected them, that they weren't too sure if they were going to worry about getting the booster. But from what I'm hearing from you is if you do not get the booster, you are no longer fully vaccinated. So you're putting yourself out there to catch it easier than you would if you go ahead and get that booster shot to, continue to protect yourself.
Yeah. I'll say one other thing, if I may. A lot of people talk about, well, I'm not going to get vaccinated because you can still get sick with the vaccine. And excuse my French, but that's just dumb. That makes no sense. The vaccines do not necessarily protect you against getting a virus. You can still catch it. You're not going to be as sick. It's the same thing with flu shots. We've talked about flu shots for over a generation. This is not our first time we've ever given people vaccines thing. People get the flu shot every year, if they should, and they can still get the flu, but usually they don't get as sick with the flu. And so we have a virus that is mutating. We're having variants. This virus isn't going away. Anybody that thought that this was going to end on December 31st of last year or this year, they have not been reading the news or paying attention. This is going to be with us for years to come. And so the reality is that my belief is we're going to get to a point. And here's the thing. I did not think this earlier in the year. I thought that these vaccines would be a little bit different and the virus doesn't mutate as fast. I was wrong. And I think reasonable people with new information and new data should be able to change their minds. That is one of the biggest problems I've seen in our country. People make a decision that, well, you said something on June 1st, and so you can never change your mind again. But the reality is that's what kids do. Adults change their mind all the time. I may want to go to dinner and the line may be 30 minutes. I make a decision, hey, 30 minutes is not worth my time. Or I see, wow, there's a brand new restaurant across the street. It is rational for me to change my mind. You can change your mind when new information comes along. And so again, will this vaccine stop you from getting a virus, potentially sick? No. Will it reduce your risk? Absolutely. But what it reduces your risk the most for is hospitalization and death. And when people say, I don't care, I just wish that I could put on those Google glasses or those Ray-Bans that have cameras in them and take people on a journey in a day in the life. And then you look at those 42-year-olds and those 38-year-olds and those 51-year-olds that look at me straight in the eye and I say, did you get vaccinated? And they say no. But all of a sudden, they want all the magical things that exist in this world to protect you. You can avoid that by getting a vaccine.
Yeah.
Exactly.
Good point.
Yeah,
good point.
Very, very good.
And as you said, if I know before you go on, Fedora, if like you talked about the flu shot, isn't a flu shot similar to a booster shot that we get every year? Because you're still going to get flu, you're still going to get the flu, but the flu shot is going to reduce you won't get as sick. And I think it's the same thing with the COVID that they're not understanding. And then they say, well, I've never gotten the flu shot. I don't want to guess. I caught the flu and I don't like the feeling of the flu. I caught COVID. I didn't like that feeling. So when you say, hey, we got another booster, you need to get it. It behooves you to go ahead and get the booster shot.
And here's the thing too. I mean, and here's the reality. I'm not one of those guys that's like, you must get the shot. Everybody has the ability and decision to make their own personal decisions. But here's what I truly believe. At this point in time in December of 2021, majority of reasonable people have begun the process to get vaccinated. If you make a decision not to, that's on you. We're not going to stop the world because you decide you want to take that risk. Fair enough. And I think you will hear some people say, well, we have to get everybody vaccinated. And I think that's a great concept. It's a great philosophy. It's 100% impossible. We are never going to get everybody vaccinated. And this is where policy starts to align with science. Policymakers then have to take a decision and say, what is the greater good? Do we stop everything because 10% of people don't want to get vaccinated? Do we allow things to open up and say, hey, you chose this life. If you get sick and die, that's on you. I think what we need to protect the most are the most vulnerable in our population, which are people above 65 and people below 5. Those are the only two populations that on average can't make informed decisions and their immunity is not the same. Right. Yeah. But apart from that, I have friends that say, dude, why are you traveling still? Why are you doing this, that, and the third? It's because I've gotten COVID, I've gotten a shot, and I've gotten a booster. And if as much as I travel and as much as I engage in the hospital, have not gotten sick in 2021, and I'm fully protected, why do I have to worry about that? My family's life has to go on. My business life has to go on. And if you decide that you don't want to get vaccinated, that's fair. But I think that over time, whether it's a mandate from your job, or the changes in insurance that will make you pay a higher premium, just like we do with people that smoke a pack a day. Take those repercussions down the road and don't all of a sudden start to cry about it and say it's not fair. First of all, I tell my kids all the time, life's not fair, get over it. Just figure that out. But you have to also understand that the repercussions of your behavior have challenges that you may not like. And you take it like an adult.
Good stuff.
It's just that simple. I like it. It's just that simple. Yep. So our last question, you've already answered it. The that the pandemic is not going anywhere. It was, I'll just read it for the sake of reading it. Is there any hope that the pandemic will end soon if nothing further is done legally to prevent the spread? So you pretty much answered that already. No,
it's not going anywhere. People need to get over that conversation. And I'm actually not sure why or how that conversation ever got started. Like there was a start and a stop, right? I mean, I think part of it, and this is where we as public health persons, we as healthcare professionals, politicians got involved in this. There was a lot of conversation about do this to reduce the curve, do this to stop the virus. And I think there were a lot of people that said, and I think I was on the record of saying this back in April, that this wasn't going anywhere, that we need to figure out how to live with the virus, not run away from the virus. We can't run forever. It's not it's a marathon, but we can't run forever. And so I think people need to realize that this isn't going away. And a lot of it is, sometimes I look at Twitter, right? And I tell people all the time, Twitter is not the real world. Right, you have crazies on both sides. You have people that are diehard. I'm terrified. I wear a hefty bag over my body, plus 5 masks, plus 6 gloves, and I wear my mask in my car. And you have the people that say COVID's not real and I'm never going to get a vaccine. The reality is somewhere in the middle, right? There's a lot of people in this country, in this city, in this state, they're living their lives irrespective of COVID. They don't have the luxury to work from home. They can't do Zoom and all the rest. They got to go to work. They put themselves at risk every day.
Every day.
For those people, I do tell them, protect yourself by getting a vaccine. If you're in that space where you can decide to work from home, and a lot of times our policy is based off of people that don't have to go to the store, that don't have to go into crowds. They work from home. They get things delivered. That's great. But if you have to, like I do, and millions of other across the country, either work at Amazon or a hospital or an office, and your employer doesn't allow you to work from home, then you got to figure out how to protect yourself. Protecting yourself has to understand how old you are. Do you have diabetes? Are you overweight? Do you have cancer? Do you have kids or older people at home that you could be completely healthy and bring the virus back to? And then make your risk calculation. If you decide to make your risk calculation, and that risk calculation is, I'm okay with not getting the virus, with not getting a vaccine. If I get COVID, it is what it is, and I'll bear the consequences. Then I don't use a lot of energy to try to convince that person anymore. Because here's the reality again, like I said, 85% of all Americans in this country have gotten one shot. That tells you that 85% of this country is reasonable in some shape or form or can be pushed with mandates. We're not going to get the other 15, so at some point in time, we got to move on.
Okay.
Exactly.
So one of the reasons we wanted to invite you to speak on this topic is because you are considered one of El Paso's foremost experts on treating populations living with infectious disease and preventive care. The latest conversation in some topics, some circles, is another area, and latest conversation is the impact of COVID-19 has regarding sexual activities. So we have a transition about the sexual activity during COVID-19. And the first question is, one gentleman wrote, it seems that prior to having sex, people are asking if you have COVID, as opposed to if you have any sexual transmitted diseases. So what are your thoughts on that? And how have concerns relating to practicing safe sex been toned down by the concerns about COVID-19?
So I'll answer the second question first. I hope that the concerns about practicing safe sex have not been toned down. I'm not hearing that from my clients. The majority of my clients are the ages 16 to 30, and I'm not hearing that from them. I will say this, COVID changed sexual activity because for a long time, people were afraid to engage with other people, right? They were at home, they weren't engaging. Once we sort of got into last summer, and then we came into this summer, there was like an explosion. And you could tell that by the stocks that started to boom. Travel stocks started to boom. Restaurant stocks started to boom. Hotels started to boom. Concerts started to boom. People were getting out and about, right? All the concerts that disappeared in 2020 suddenly came back in 2021. And so people were engaged, and a lot of young people were engaged. And again, talking to my clients, talking to people, talking to the state, I'm not hearing that people are choosing one over the other. It's just an added thing. Like, hey, you vaccinated? You got a test? And a lot of these concerts mandate that you either show proof of vaccine or proof of a negative test anyway, right? So a lot of people that are going to these concerts and a lot of young people going there, they've already been tested. And so the unfortunate thing, however, sort of to segue or pivot to another conversation about sexually transmitted infections, is that we have some of the highest rates of STIs that we've had in a decade. Those rates have consistently been going up. And COVID didn't change that, right? It just tells you that people continue to have sex, but just in different manners, right? Whether it was whatever the case may be, right? But I think the point here is that people are still having sex. People are always going to have sex. I think it's important that if you're sexually active, that you have a conversation with your partner or the person you're about to have sex with. If you're meeting them on an app, whether it's Tinder, Grindr, Feed Me, whatever it may be, then you have that conversation up front. Hey, you tested? You got COVID? I prefer not to get COVID. And hey, can you show me your HIV and your STI test? Or let's use condoms, whether they're male or female. I think those are very important.
Exactly. Can COVID-19 be transmitted through sexual contact? If so, how?
It depends. So it depends on what you define as sexual contact. If you're saying, is it transmitted through genitalia? No, that's not how it works. But my assumption is that most people have sex at some point in time, face to face, right? Or they're in a confined space. And so if you're talking, coughing, it's exertion, just like any other exercise, you're panting, blowing virus out of your nose if you have it. That's how you get it. Now, like I said, it's not genitalia, sexual fluid, but face-to-face contact, coughing, sneezing, kissing. That's how you get it.
Okay. Glad you cleared that up.
You got a date? Did you have a date, sir?
Some other stuff. You was trying to be nice about it, talking about kissing. You know, people do other things besides kiss.
Absolutely.
That's what they talk about.
And whether it's oral sex, I mean, I'll be very clear about this, right? I'm a sex doctor at the end of the day. My core upon ID is HIV, hepatitis C, and sexually transmitted infections. That's what my clinic does, I believe, better than anybody else, is oral sex. There is no evidence that you can transmit COVID from there because the COVID virus doesn't live in the genitalia. Where it lives in your lungs and your upper respiratory. And so you need some sort of face-to-face contact. And I think that is the key when people are asking, can you get it from COVID or can you get COVID from sex?
Okay. So since the pandemic began, has there been an increase or decrease in sexually transmitted diseases? That's the first part of the question. And then how does those numbers compare to pre-COVID era? Would you know anything about that?
Yeah, I do. So it's hard to tell. You got to remember that when the state releases data around any health conditions, it's always at least 12 to 18 months behind. The most recent data that we got this summer showed that our sexually transmitted infection rates continue to climb, particularly in people that were 13 to 25, but there's also a little bit of a spike in older people. Baby boomers, Viagra, Cialis have been huge for that generation's sexual activity. And so they're getting STIs that historically they had not gotten before. But we continue to have increases. We won't know about what happened during core COVID years until next summer, right? And so it will be interesting to see a year from now, or next summer of 2022, what this year's data shows and whether there was a decline. What we know is that there was a transient decline in babies, but then there was a subsequent increase in birth rates as we sort of came out of COVID, right? So I think it's too early to tell, yet to be determined. My guess is that there will be a potential dip for a while when we look at the data because people were just indoors, but maybe they caught up after they got released.
Some believe the myth that the only way sexually transmitted diseases can be transmitted is through intercourse. Please share with our listeners why this is false.
Well, I think the first thing is we got to find what a sexually transmitted infection is, right? We have gonorrhea, we have chlamydia, we have syphilis, we have human papillomavirus or HPV, we have trichomonas, we have HIV, right? So let's say that those are the main ones. Mm-hmm. On average, HIV is a sexually transmitted infection. It's penis, vagina, penis, anus. That's on average how it's transmitted, right? And so I think that's important. However, whether it's gonorrhea, chlamydia, HPV, and again, this goes back to Curtis's question, is that people are really trying to cut to the chase on. Can it be transmitted through oral sex? Absolutely. In fact, there is evidence and data that supports that oral sex, you can actually develop oropharyngeal cancer if you're performing oral sex on somebody that has HPV. We already know that people can get gonorrhea in their oropharynx, right, in their rectum, in a host of other places. And so when we have clients that come in for swabbing, we don't just do a blood test or a urine test. We swab the back of their throat, we swab their rectum, we swab other sites to see if they have it. So the truth is that you can get a host of these sexually transmitted infections from a host of different sexual acts. And so again, I think the key is try to protect yourself, get tested frequently. There's no shame in getting tested. People say, well, I feel as if I'm dirty or if I'm promiscuous if I'm getting tested. I mean, you've already had the sex, so make sure you're protected. Why are you going to have the sex and then hide in the closet? You know what I mean? It doesn't make any sense. Get tested. Make sure that if you're going to have sex, and there's nothing wrong with sex, it's a great thing, that you are tested, free, and safe, not just to yourself, but safe for your partner or partners as they may be.
Okay. Exactly. Okay. Some believe the myth that the only way sexually transmitted diseases can be transmitted is through intercourse. Please share with our listeners why this is false.
No,
I thought you just asked that question.
I just asked.
You read that question?
Behind.
Oh my goodness!
He's in shock. He's in shock at the bluntness of this conversation. I think all the sex talk has confused Curtis.
Yeah. So somebody when they found out what you do, Dr. Alozie, they brought this question to me, and with HIV, with you treating HIV patients, right? What are your thoughts about the commercials that are coming on that saying, "Hey, don't stop your life because you have HIV. Take this pill or this pill." It's like 3 different commercials about.
I've seen them.
Right. That's telling people with HIV, go ahead and live your life. Take this pill, but get with your doctor first. This isn't this. Can you elaborate on your thoughts about that and people not being honest about saying this? They're saying, I'm taking the pill. I don't have any symptoms, so I'm gonna go to have sex with somebody and not tell them, or do tell them, So their concern is like, how do you feel about that, being a doctor and you see these commercials and you're treating these patients that have HIV, and then you see these commercials come and say, hey, live your life, go take this pill and daily pill and their levels will be to show that you don't even have HIV or AIDS or whatever the case may be. What are your thoughts on that question?
I'll address this on multiple levels. I think it's a great question, but the question also shows me sort of where we in public health have failed to educate the community about HIV. A lot of people still believe HIV exists as it did in the 80s and 90s. And we're way past that. If you have any questions about how HIV controlled, go check out Magic Johnson. I don't see Magic hiding in the closet. Magic's living his best life. In fact, Magic stopped being the GM of the Lakers because there was too much work. He wanted to travel. He wanted to party. He wanted to do all those things, right? Now, what people need to understand is that the medications today are very different than they were in the 90s and the early O's. It's 1 pill once a day on average. It has almost no side effects. You're not going to see people that were in the 80s and 90s that had the sunken cheeks and had lipodystrophy is what it's called, and had lost 50 pounds. No. When my patients and my clients come into the clinic, the first thing I ask them is, what are your goals? And it used to be, well, I just don't want to die. And I was like, I got that. That's the easy part. You're not going to die if you take medication, right? Nobody should die of HIV. If anybody dies of HIV now, either their physician failed them 100%, or the patient refused to take medication. People don't die of HIV anymore. That should not be a thing. The second point here is that the medications are so good and so powerful that, like you said, they get your viral load, the amount of HIV in your body, down to undetectable, And the science is clear, whether it's HPTN, whether it's the partner study, whether it's the Swiss sex study, it's clear that if you are undetectable consistently, you cannot transfer HIV via sexual intercourse. And so that is where all of those commercials are coming from. The data that's been driven over the last decade that clearly shows take your medication, get undetectable. HIV should not be a concern. And I tell my clients when they walk in, you're 25, you're going to live to be 80. If you keep healthy, if you don't get cancer, HIV will never kill you. Or if you take your medications, and that should be the message to anybody. So I hear some stigma in that question. It's not a bad question. People that are asking it don't live in the world that I live in. They're not experts in treating HIV. But I think it is still part of the stigma that we need to get out there, right? Because the reality is that I tell people this all the time. If you had to choose something to have at the age of 25, diabetes or HIV, I would choose HIV.
Wow.
Because diabetes, you're going to lose your vision. You're going to lose your sight. I mean, you're going to lose your sexual function. You're going to have toes or fingers lost. You're going to have all these complications of diabetes over a 30, 40, 50-year life. But in HIV, I can get you to 70 and 80 comfortably, one pill a day with almost no side effects.
Wow. Such a change, huh? From the way it was.
Yeah, I mean, that's science, right? That's medicine. Yeah. That's the way it should be. It's cancer. I mean, think about cancer. People are now living with breast cancer 10, 20 years beyond. That didn't happen a generation ago, right? People, colon cancer are surviving. Pancreatic cancer still kills people, but people are living multiple years from the diagnosis of pancreatic cancer. The key here, I think one of the take-homes in this conversation, hopefully, is people need to ensure that they have a relationship with some sort of clinician, whether it's a nurse practitioner, a PA, a physician, right? Driving your care. It's not, I just don't think it's acceptable. And I hope people take away from this COVID sort of journey that we're on, that you need some sort of relationship with your clinical health provider to help you navigate things. Google doesn't cut it. Newsmax doesn't cut it. CNN doesn't cut it. None of those things cut it. You have to have an up close and personal front row seat with your physician to give you the best advice.
Exactly. Thank you so much. We had, I guess, some questions, I think, on another platform that we're on. It says, I guess, respiratory infection is much higher among healthcare workers wearing cloth masks compared to medical masks. What would you say cloth masks should not be used? And I guess that's in the medical field.
Yeah, I would tell anybody that works in the medical field, if your employer is giving you a cloth mask, quit. That's crazy. That's unacceptable. I mean, I'm very serious about this. And I sit on the governor's task force for COVID and infectious diseases. I sit on the Texas Medical Association task force for it and the city task force. That is a crazy statement to say that a healthcare worker is still wearing a cloth mask. That's unacceptable. At the minimum, it should be a surgical mask. And if they're dealing with COVID positive patients, it should be an N95. I'll take it a step further because I hope somebody that is involved in the school districts hear this. I think it's unacceptable, the conversation that we've had in this community about masks and kids. All these Snoopy masks and Transformer masks and Harry Potter masks are the equivalent of trash as far as I'm concerned, especially with the virus that is much more transmissible in Delta and Omicron. It's a little bit early, right, for us to get into that because we don't know enough data. But if it is transmissible, then cloth masks absolutely have to go away. The school districts have failed us in not being more forceful and strong in mandating not just the wearing of masks, but the right mask. A child should not wear any other mask versus a surgical mask or a KN95 or a KN94. If they're wearing a cloth mask that gets wet in under 10 minutes, at worst an hour, they're deceiving themselves and it's performative. And so I steal that word from my daughter all the time. She loves it. It's performative. It's just a performance, right? They're just dancing in the streets to say that they're running. And so I went off on a tangent and I appreciate that. But yeah, no healthcare worker should be wearing a cloth mask in 2021. That's malpractice.
Right.
Okay. And so my question to that is, everyday people who are not in the medical field, like I'm a teacher. So I should not be wearing a cloth mask. I should be wearing, even though I made double masks, which I do, that I should wear the, the disposable mask would protect me better.
Yeah, so I'll get off my soapbox for a second and kind of pivot back. So I think here's the question. It all depends on what type of protection you're looking for. Okay. If you're looking for what I'll call marginal protection, a 5 to 15% reduction, a cloth mask may do that as long as you can keep it dry and as long as you double mask it. If you're looking for about a 20% reduction, 20 to 30% reduction, that will be a surgical mask, right? Disposable surgical mask. And if you're looking for high grade protection, then it has to be a fitted N95 or at the very least a KN95. Again, I'll circle back to what I wear when I travel. I wear KN95s. I'll circle back to what my 11 and my 15-year-old wear when we travel. They wear kids KN95s that they double tie at the ears and they form a tight seal. And people say, well, how do you do that? And it's uncomfortable. I mean, I flew from here to Atlanta to London, and we wore masks throughout the whole period, right? We went from here to Miami to Curacao. Again, the same things. It's doable if you're trying to protect yourself. But if you're just wearing it because you were told to wear it, you really don't care. I mean, wear whatever.
Mm-hmm. Yeah. They're saying some folks are making homemade masks to sell to the public. Are they reliable protection?
Yeah, don't buy them.
Say again.
Easy button.
He said don't buy them.
Don't buy them. Easy button.
Yeah.
Yeah.
Again, and here's the thing, right? It all depends on what your goals are, right? If your goal is to be stylish with it, you want a blinged out mask, buy whatever, right? If you're trying to stunt with it, you can do whatever. But if you're actually trying to protect yourself and your family, then you need a high quality mask. And I think Omicron is going to prove whether it's more contagious or not. It seems as if it potentially may be. But I think it was in Sweden or may have been in South Africa, a concert where people were wearing cloth masks. They needed to get tested. Somebody had Omicron. It seemed to have spread to over 30 people, majority of whom were vaccinated, right? But on average, they didn't have what I now call high quality masks, right? They had homemade masks, cloth masks, or no masks at all. And so again, you got everybody at this point in time has to determine what their risk is, has to determine what they're trying to protect for themselves and their family, and then you go from there.
Oh, okay. Wow.
I mean, I'll say this, right? I'm sorry to go off on a tangent again, but so masking has gotten political, right? There's some science behind it. There's some behind it. Here's what I know. When you're in the hospital, you wear an N95 when you walk into a room. Some people wear goggles. Some people wear gowns. Some people wear gloves, right? That is the highest grade of protection. Mm-hmm. However, 2021, fully vaccinated, when I walk into a restaurant, do I wear a mask? No. Do I wear eye protection? No. Do any of the people that I'm having dinner with? No. Does anybody in a restaurant actually wear any of those things? No. And yet, we haven't seen any outbreaks in restaurants. We haven't necessarily seen any documented outbreaks in bars and clubs in El Paso because majority of this community is vaccinated or has natural immunity. Now, how long that natural immunity will last compared to vaccines, we just don't know. I don't think anybody can tell you very clearly. But again, I think where you wear a mask, how you wear a mask, and the right type of mask is all dependent on where you're going, what you're trying to do, and what you're trying to protect yourself from.
We have a question. Why is the Omicron variant now showing up in South Africa?
I mean, what we're beginning to see is that it's not a now thing, that this actually was identified in some other countries prior to South Africa. South Africa is in the middle of a surge. And so as they were testing through their surge, they identified this variant. This may have been in some other countries. What we know is all about surveillance. If you're not doing surveillance and testing multiple viruses, right, 10 to 20%, you're not going to pick these things up. And so kudos to the South African Public Health Organization for doing that, right? I think where I get a little bit frustrated is that, okay, they identified it, and the news media, like I said, they wanted clicks, they wanted fear, they wanted that anxiety, they wanted that outrage, and they've revved everybody up. And it's like, on your mark, get set, hold up a second, because now they're pumping the brakes and saying, we actually don't know. it's too early. I'm like, you knew it was too early 3 weeks ago,
before.
fool. Yeah, why did you make it seem as if the sky was falling? The sky wasn't falling then, and it's not falling now. We've identified maybe 30 or 40 cases in the United States. Stock market has fallen. People are terrified. They're scared. Pump the brakes. The prevailing variant in the United States right now, 98 to 99%, is Delta. If you are truly afraid of COVID today, your concern should be Delta. Will Omicron show up in months to come? It is very possible, but we don't know. What we do know is that those that have gotten sick from this, on average, the vaccine has protected them. So if you really are worried about this, go get vaccinated. If you just want to feed into the anxiety and fear of the unknown, not a lot of things we can do to stop you from doing that. And again, it is what it is.
Yeah. Gotcha. I thank you so much for this information. It's really good information that I think we really need to know and hear. Sour Patch Kids.
He's trying to get he's trying to get his neck bigger, Fedora, because he don't want to look at Shoot.
I thought you were eating on some chips. He eats Sour Patch Kids.
Nah. Hey, the doctor's eating junk. Hey, the doctor's eating junk on the show instead of eating like fruit, eating some fruit or some carrot sticks.
I did protein and veggies all day. I mean, I'm in my office and it's here. There's no food in my office. So I need a snack. I need a pick-me-up.
Yeah.
They're like, is he really eating candy? He should be eating carrot sticks or celery and peanut butter or something.
No. Do you eat that, Kurt?
Yeah, I do. Sometimes. They call it cheating. Dr. Alozie, they call it cheating because when I'm going for my doctor's appointment, right? Like a month out, I'll start eating all my fresh fruits and vegetables, baked chicken, celery and carrots and salad.
And just let him
no
know
fried food. Then when I get it, like,
work.
oh, your cholesterol is great. This is great. This number is great. And after I'm done, I go right back to I'm gonna get that fried chicken, man. I passed the test
for a bunch of my friends, and so I know what they do because I eat out with them. And I just be looking at them like, really? You're gonna be here in like 30 days, my lab's good, doc. What's going on? you just finished a bottle of Ghost Block, and now you're asking me about your labs.
Yep, I drink water every day, like Fedora's. I drink water the whole time. Just water,
agua,
no sodas, nothing. And I go there like, oh, you're good. And so it's like, yeah, thank you. As soon as I leave, let me get a Pepsi.
Popeyes.
Yeah. Ridiculous.
Yeah,
that does not work, Curtis. You need to change.
You're right. You're right. I told my secret, so I was honest today. I told my secret.
It's impressive. Yeah, very impressive, sir.
Yeah. But
we have another question. I have one more question. Are locals STD numbers increasing in El Paso among what group?
I mean, they're definitely increasing. I mean, are they the highest in the state? No, but they're continuing to increase. I mean, the reality is that people have sex, and sex is a lot easier to have these days. You have apps, right? You have the hookup culture. You can get on any social media platform and meet people to have sex with. And so it makes sense that there's an increase in STIs. And who's that population that feels invincible? 16 to 30-year-olds on average, right? And so that's where the highest rate of STIs is. It continues to be chlamydia, gonorrhea, syphilis, and it's unfortunate, but I'm not really sure. I'm not sure that's fixable. And I hate to be that Debbie Downer because I am an internal optimist, but as I sort of look at where we are in today's culture, and sex is a great thing, and how sex is easy and negotiated and monetized in a host of ways and appified, you can't stop an app. And so unless you decide to turn off the internet and lock everybody at home, people are going to have a lot of sex. What you want to do, and I think this is where we don't do a great job in the state of Texas, is that we don't educate kids about sex early. And whether it is Hispanic culture, Black culture, the South culture, red state, blue state nonsense, we do not educate our children enough about what sex is. Sex is a great thing. Have sex, but have sex in an educated and safe manner. And where this frustrates me sometimes when it becomes political is this. What I see consistently is that people that have financial means, their kids understand what sex is and how to protect themselves. It's people that don't have financial means, irrespective of race, that do not. And you can see that in a host of other reasons, right? So the people that are making the political decisions around funding for sexual education, abortion, plus or minus, I'm not going to get into that. Every single one of those persons, on average, has a financial means to live above the law. And so when they make those laws, they're not making them for themselves. They're making them for the rest, all y'all. Right. Yep. And so I think one of the things that I often tell people in healthcare and when I give talks on technology, you have to enlighten yourself to what your circumstance is and what decisions you make. Are you making decisions for yourself, or have you been pushed to a decision because you're watching CNN or Fox and Friends, or you're reading some junk on the internet that makes no sense, right? And you think you're woke. You're not woke. You're just hurting yourself. And so I think as we sort of improve our health and improve our communities, be there here, across the state, across the nation, we just have to do a better job of enabling our children to be critical thinkers and being smart for themselves, not for the hive, not for the horde, not for the gram, but for themselves. Because the gram's not going to help them pay their mortgage or treat their syphilis or their HIV or go to college or whatever they decide to do.
Right.
Soapbox number 2, I'm sorry.
That's education, sir. That's education.
Yeah, true. You don't. Yeah, we have to.
I just saw the question pop up. Are those that contracted COVID and survived more protected than those that received the vaccine? It's unclear. What the data does seem to show is it depends. ... If you got the milder the case of COVID, the less protection you got. People that had more severe COVID symptoms, were sicker longer, have higher antibody levels, assuming they didn't die, than people that did not or had mild symptoms. And so if you had mild symptoms of COVID like I did, probably didn't give you that much of a boost. But getting vaccinated will kick that into overdrive. And so again, I tell people that get COVID and like, well, I don't need to get vaccinated. I'm like, I'm not sure about that. If you're 22, you're probably right. You may not need to get vaccinated. Your odds are very low. If you're 72 and that's the chance you're taking, I'm not sure I would make that decision.
Good. Deep. Yeah. Did we get anything else? Fedora?
Yeah, I just had a question when he said it and it just escaped me.
Where'd it go? Fedora?
It went in and he was talking and I was listening and in my thoughts and I listened to what he was saying and then it just left. But yeah, hopefully I'll get it back. Go ahead. Thanks.
What about you, Curtis? You got anything else?
Oh, that's all I received. But while we got you here, tell us how we can find you. What's your handle and all that good stuff?
Yeah, so the website's right there. It's Sunset ID Care. We're actually going through some changes. I have a couple of organizations that are sort of housed in the same building. One's a nonprofit for persons that need access to care. We get a lot of government funding for that. That's called Southwest Viral Med. And then Sunset ID Care is the group that I take care of patients in the hospital, do one-on-one clinical care for people that have infectious diseases, whatever it is. We're sort of merging. We're going to change our name. It's going to be called Sunset West. So we're rebranding the website and a host of other things. But for now, Sunset ID Care is the email. And if it's on Twitter, it's Ogeisimo, which is OGEISIMO. That's my Twitter handle. And yeah, I'm on there. I try not to be crazy on Twitter anymore. I was doing a little bit too much earlier in the summer, but I'm too busy now. And like I said, I realized that Twitter isn't real. It's not the real world.
Right. Any clinics coming up? Any clinics you're going to be having in reference to anything?
Right now the clinic is over sort of central. It's by El Paso High. I can see El Paso High out my window over on Schuster Avenue. We're sort of thinking about starting something over on the Northeast. We're working with some partners. Can't really discuss that right now, but we're hoping to do some sexual health sort of intervention clinics on the Northeast first quarter of next year. And we'll sort of stay tuned. We'll get that information out there. But yeah.
Okay. It's good stuff. Good stuff. It's good. You got anything, Fedora?
You remember your question?
I don't. I'm
So
at that age now.
It escaped her and didn't come back.
At that age,
It's just a part of it. If I don't write it down on a sticky immediately
it disappears.
or say it out loud, it
absolutely.
It leaves.
I hear you.
It's in the air.
Well, Dr. Alozie, listen, we appreciate you coming on Suite 915. We hope that we can have you again and get some updated information in reference to what's going on in the world with sex and COVID-19. And we appreciate you coming on and spending your time, your Sunday afternoon with us. And I think everybody enjoyed the informative information that you gave us and enlighten us. To me, you enlightened us. You told the truth about some of the myths and things that's going on that people don't believe. And you shared that and you talked about it from a professional standpoint. So they can't say Fedora and I made it up. So we gave you true and faith from the horse's mouth. So we appreciate you coming on. Anything you want to tell the people before you get out of here? Because I know you got to get back to work and save more lives.
No, I think we're good, man. I mean, this has been good. I appreciate y'all for having me. It's always a pleasure. And let's do this again.
Okay.
All right. Thank you so much for the information.
All right. Have a good Sunday. Have a great week. Happy holidays. It's almost Christmas. And
Christmas, in the Christmas spirit.
I do love Christmas, so it's all good.
Yeah.
I appreciate y'all. Have a good one.
Right.
Okay.
Thank you.
Thank you very much. All right.
Thank you.
Bye-bye.
Well, that was good, Fedora.
That was good.
We got some community upcoming topics. And I mean, if y'all want to have a discussion, just we will announce the date of the much anticipated show on mental health and relationships. What topic would you like to address? Hit us up on the realsuite915@gmail.com or message at host Curtis Smith or it's me Fedora at it's me Fedora 1. Is that one? That's the number IG. 1, right, Fedora?
IG.
Yeah. So I think we can get on to the local events.
Okay.
All right.
Go for it.
That's what I say. Go for it.
So our first local event, the Paso Alumni Chapter of Delta Sigma Theta Sorority Incorporated, National HIV/AIDS Awareness, Trek the Canyon for international awareness and solidarity in our community, highlighting our upcoming commitment to communities by maintaining outreach efforts to stem the AIDS epidemic in our families, communities, country, and abroad. It'll be at McKellican Canyon at 139 Davis Simone Road here in El Paso. It starts December the 11th, which will be next weekend, and it starts from 8 a.m. to 10 a.m. So you will meet at the bottom of the canyon if you're going to participate. Get your wristbands. You can also contact Tanya Bartlett. And here's the number, 254-251-002. 254-251-0002. So that's your contact.
Okay. El Paso Holy Royal Arts. Yep. El Paso Holy Royal Arts, chapter number 90 here in El Paso, Texas, along with the VFW Post 2451 and the Northgate Optimist Club will be hosting their 10th annual community drive-through Christmas dinner. We are adhering to the COVID guidelines, guidelines to make sure that the event is the safest one for everyone. Let me see. For your safety and the safety of others, please wear facial coverings and maintain good social distancing. It's free to the public, open drive-through, Saturday, December 18th, 2021, 2 p.m. until all food is gone. This location will be 4201 Skyline Avenue, El Paso, Texas, 79904. That's in the Northeast. So that's 4201 Skyline Avenue, El Paso, Texas. If you have if you would like donations or questions regarding the dinner, please contact myself at, that's Curtis Smith, not host Curtis Smith. This is my other email, Curtis Smith at coolc95@yahoo.com. Ronnie Betts at WCW499 at yahoo.com. Lamont Griffin, Travion64 at yahoo.com. DeJuan Mason Sr. at DeJuanMasonSr at gmail.com. So it's a free event. Come on through, drive through. You don't have to even get out your car. Just tell us how many people, how many plates you need, and we give it to you, and you keep rolling through. So we look forward to seeing you out there December the 18th.
All right. All right. Our next one is our Dr. Martin Luther King Jr. celebration, which will be on January the 16th of 2022. Feels so weird to say that. It's going to be at 3 p.m. at the Mount Zion Baptist Church at 3400 Wyoming Street. The zip code there is 79903. Your person of contact is Lady Maureen Simmons. The Martin Luther King Jr. Committee of El Paso. You can also call 915-781-8163. And our keynote speaker will be Mr. Kendrick Lusk. So join us for the Martin Luther King Jr. celebration.
Yeah, we have an Omega Man event, Mardi Gras and Sweetheart Masquerade, February 12th, 2022. Doors open at 9 p.m. Tickets are $35. This is the Sigma, the Omega Psi Sigma Chi chapter, alumni chapter in El Paso, here in El Paso, Texas. For more information, call 270-319-6451 or 501-502-6290. Email, you can email them at borderqs@sigmachi-oppf.org. And that's February 22nd, 2022, $35 ticket, Masquerade. If you don't have a mask, they'll sell you one at the door.
Oh, nice. All right. I think that's it for announcements.
Yeah, no, we have one more, Fedora. We have a New Year's cheers. Okay. We're looking for El Pasoans who can help us complete our 10 ways to celebrate New Year's Eve virtually. Compilation, send a video, or come on the show to share your ideas with others. 2022.
All right. Yeah. So I always want to bring in the new year with friends and family, but
I know, right?
Make it.
You can still have your events, Fedora, but just keep them small. We don't want 100 people in your house, or 50 people in your house. Just you, your grandbaby, your son, and his significant other, and that's it. And make you some shrimp cocktail and crackers.
I don't like shrimp cocktail. I like cooked shrimp. Thank you very much. My food needs to be cooked, okay, Curtis? You gonna stop? You gonna leave me alone?
I'm leaving you alone, Fedora. Mm-hmm. Hey, Fedora's gonna be eating vegan duck for Christmas.
You know what? I'm not fooling with you. Anyway, to the people out there, send any new events that you may have to the email so that we can post on Suite 915 and let the people know about your event. So if you want an event announced to get it out to the people, then just email us the flyer and we will get it out there. All right, Curtis, what else do you have?
All right. I got a question.
What?
You don't miss that Southern fried chicken with gravy and rice?
Well, I'll let you in on a little secret. I never liked gravy. And no, I don't miss chicken. The only thing I missed when I started going vegan the first time was seafood. And it shocked me as well, because my diet before I became a pescatarian consists of fish and chicken mainly, right? But I didn't miss the chicken. I only missed the seafood. And when we had the show and we had the young ladies on, and I found out about I could eat my seafood and still be like vegan, pescatarian, I was like, okay, I'm jumping on the bandwagon. Don't y'all get mad. So I've been doing it for about 9 months now? Mm-hmm. Yeah. So, and I don't miss it. I love it. I mean,
I hear you, girl. I hear you.
But I know you still need that, fat back and oxtails and
Hey,
lamb,
hey,
liverwurst or whatever
I
you
don't
eat.
eat all that stuff. I don't eat all that stuff. Some of that stuff I don't eat. But I plan on, doing
Pig's
something.
feet, pickles,
I don't eat
feet.
pig's feet. I don't eat pig ears.
Pork chops.
Oh, I love some pork chops and gravy though.
Rat tails and frog legs and alligator eyeballs.
So see, Fedora, people told me to leave you alone. Okay, you can eat alligator. You from Florida? Fried alligator tail.
I never have eaten alligator. No, I never have. No, thank you.
All right. Well, we got to go because they said stop messing with you. I'm gonna leave you alone. But I'm glad you're in the Christmas spirit. Thank you for letting me wear your elf hat yesterday.
Return it. I want it back today.
Yes, ma'am. Yes, ma'am. Once we get off this, I'm gonna go get some stuff and I get it to you. It's in the car. Okay. Yeah.
Everything is in your car. You trying to tell us something, Curtis?
You don't understand. You don't understand. What?
All right.
The rat.
The rat tails. Show me. I had to throw that in there for him since he always messing with me about stuff, right?
Okay. All right. But yeah. Once again, thank y'all for tuning in today. It's NFL Sunday. Hope your teams won. If you're a football fanatic like myself.
What team were you going for today?
I got to go for my Steelers, but I think they lost. I didn't watch the game because they, people say too much negative stuff in our group that I was like, I don't want to hear all of that. So I didn't watch the game. So I'll find out on ESPN if we won or not. I think congratulations to congratulations to the men of Alpha Phi Alpha Fraternity Incorporated for 115 years. Being in existence for 115 years. I think they celebrated that yesterday, Friday. I think it was Friday. So congratulations to the gentleman. What else we got going on, Fedora? That's it.
Graduates that are graduating at UTEP. Congratulations to the UTEP graduates.
Congratulations to the UTEP graduates as well. Congratulations.
They'll be graduating this weekend coming. So congratulations on that.
Great milestone in your life. Congratulations to all those there at UTEP. Yep. So what you got for the people, Fedora, before we get out of here?
Nothing. Just continue to keep loving your heart and do something for somebody else from your heart. Stay safe. Wear those masks, as Dr. Alozie told us. Get the proper mask, and it all depends upon your percentage safety level, what your goal, what you're trying to accomplish. And remember the reason for the season.
Remember the reason for the season. And hey, call somebody that you know that's alone, need to hear your voice, or just to say I love you. Remember, it's the holiday season. Don't leave somebody alone by themselves. It's mental health. Think about that stuff. So take them a plate or something like that, or send them a card for Christmas. Do something nice for somebody.
A call or a text will go a long way.
Call, text, or just say hello. So thanks again for tuning in another episode of Sweet 915. We'll see you next time right here.